48,000 new cancer cases are reported in Kenya every year, with 33,000 cancer-related deaths recorded annually. This translates to 90 deaths every day, or 4 people dying every hour due to cancer. Cancer is a crisis of enormous physical, spiritual, economic, socio-cultural, and political magnitude.
One of the things we are suggesting is that the NHIF and the government needs to partner with KEMSA to be able to access these cancer drugs at a very cheap price, and this will be able to make sure that many patients access the treatment that they otherwise are now struggling to pay for. We know many patients are holding harambes and they are putting up pay bill numbers for contributions.
Parliament, through the Health Committee, can easily pass supplementary budgets with all the what we have been through as a country over the years. Maybe it's time to look at a supplementary budget, not for brick and mortar, but to address cancer control issues.
We should have constant medical checkups. We should not be afraid to be screened. And here again, we would ask the government to help in making this thing cheap and available down to the wards and to the villages.